After your surgery, you'll want to take it easy for about 24 to 48 hours, depending on the extent of your surgical procedure. You want to avoid getting your heart rate elevated too high or being too active because you'll have more bleeding and potentially more swelling.
So after you have a tooth removed, we'll provide gauze, typically for you to bite on for the next 30-45 minutes in order to control bleeding afterwards.
It's really important to keep your mouth clean in your healing phase because that's your biggest risk for infection or dry socket. So making sure to brush all of your other teeth, rinsing out the area where you had your tooth removed, and making sure to stay away from really crunchy and spicy foods for a few days is important.
Oftentimes we will prescribe a special mouth rinse you will use, and we just want you to gently rinse and very gently let it drain out of your mouth twice a day for a week or two following your procedure.
Typically after wisdom tooth extraction or other extractions, we will give you a syringe that you can use to rinse out the area with mouthwash. You usually do that twice a day, and you continue that until you can't see the hole from where the tooth was anymore or until food stops being evacuated from the area.
Your pain will be managed after surgery with a combination of medications that are right for you. Most often it's going to be an anti-inflammatory like Motrin or ibuprofen, in addition to things like Tylenol.
Most patients are surprised to find out that there's generally no need for antibiotics at the time of oral surgery. If there is, we'll provide clear instructions for when to start and complete this medication. You want to make sure that you take it until it's gone and get all of the doses on time. I often encourage patients to set an alarm on their phone as a reminder to stay on track.
So it's very common for patients to have swelling after surgery. For that, we typically recommend a cold compress. In some cases, we might prescribe some medications that can reduce swelling.
After surgery, a combination of ice and heat is beneficial. The first 24 to 48 hours, ice will help you the most. It will also just soothe and help you feel good. After 48 hours, warm heat is going to be your best bet for relieving tension in muscles and helping restore blood flow to the area.
Sometimes we do have to put stitches in the area where you have had surgery. If we do, they're always dissolvable, and they break down usually after a few days to about a week.